light environment. If a person goes from a brightly lit environment to a dark environment, it will take roughly 5 to 6 minutes for adjusting to the dark environment. Now, what else? This is normal eye, this is cataract eye. Normal eye. Normal eye functions very normally. Whereas cataract eye, such as a person getting even specs, or he has night blindness or some disease in the eye, that eye is known as cataract eye. Now, I would like to say about eye. The medial rectus muscle or lateral rectus muscle are the main ones. In this only you could see three, but in reality there are thousands of muscles in our eye, which makes our eye move right, left, diagonal, upward and downward. The causes of night blindness are again divided into two categories: the treatable and the non-treatable. The treatable are cataracts, nearsightedness, uses of certain drugs, but in a controlled way, and of vitamin A deficiency, which is rarely used. Non-treatable, retinal squamosata. This type of non-treatable causes are, it will be carried by genes such as father, mother, and who is having, if anyone has any night blindness, it will be carried permanently through the genes of the child. Thank you.
Good afternoon. My name is Akshan. I am Devika. And I am Abhishek. I am Vani. Today our topic is cataract surgery. Cataract surgery is a removal of natural lenses which has developed opacification. Metabolic changes of crystalline lenses fibers over time leads to loss of transparency and loss of vision. Many patients' first symptom is that they can't control a strong glare of light, etc. This when you get cataract, it is replaced by synthetic lenses. Cataract surgery is mostly done by an ophthalmologist, and more than 90% of the operations have been done successfully and with low complication rate. As we know, there are many types of cataract surgeries. The most common cataract surgery is physicalization. In this, there is a machine that involves ultrasonic frequency, and with the titanium steel tip. This still vibrates at the frequency of
the vision, which objects which are far away from us are seen appear blurred, but the objects which are near to us are seen clear. Now my friend is going to explain about the causes.
This is the diagram of a myopic eye. What happens in a myopic eye? Light rays have to, for an image to be clearly formed, light rays have to be focused in the retina. But what happens in the myopic eye? Light rays focus in front of the retina. What are the symptoms when you have a myopic eye? You have eye strain, headaches, and squinting. These are the three most common symptoms of having myopic eyes. Moving on to hyperopia. Hyperopia or long-sightedness happens or is a defect of the vision where far objects are seen more clearly, but objects which are near us or in front of us appear to be blurred. This is a diagram of hyperopic eye. Here, light rays focus behind the retina rather than on the retina. What are the symptoms? Symptoms are very similar to myopic eyes. Squinting, eye strain, headaches are very common. So there is no established cause for myopia and hyperopia. Sometimes it's genetic, but sometimes it's other environmental factors. So how do we treat myopia and hyperopia? Treatment are PRK, LASIK, refraction surgery and CK are the four treatments. Four most common surgical treatments. But the most common approach is using lenses. To treat a myopic eye, a concave lens is used. A minus powered concave lens is used. For to treat a hyperopic eye, a convex lens, a plus powered convex lens is used. Now we have a short demonstration. This is an example of a myopic eye. It's an effective myopic eye. When you see it from here, you're not able to see. It's blurred enough. But once using a corrective lens, we will be able to see what's written here. Thank you.
My name is Shreya.
My name is
Today, we are going to say about color blindness. Color blindness is also known as color vision deficiency. It is the most decreased stage in which we can't see color or difference between color. Now, I'm going to say the causes of color blindness. The most common cause of color blindness are an inherited fault in the development of one or more of the three sets of the color sensing codes. In the eye, males are more likely to be colorblind than females, as the genes responsible for color blindness is the X chromosome. Females have two X chromosomes and a defective one is compensated, as the males have only one X chromosome. Now, color blindness can also result from physical or chemical damage to the eye of the brain and parts of the brain. Now, I'm going to explain the mapping of the X-linked inheritance. The X-linked inheritance is an disease of color blindness, and the unaffected father gives his X chromosome to the first daughter, as the guardian mother gives the first X chromosome to the daughter. So the first daughter is not affected by color blindness. The father again gives his X chromosome to the second daughter, and mother gives the affected X chromosome to the second daughter. So the second daughter gets affected by color blindness. Father, yes, unaffected father gives his Y chromosome to the first son, and mother gives the X chromosome to the first, her X chromosome to the first son. But the X chromosome
Our topic is LASIK eye surgery. He is going to explain what is LASIK and the full form of LASIK.
LASIK is commonly referred to as laser eye surgery or laser vision correction. It is a type of refractive surgery for the correction of myopia, hyperopia, and astigmatism. LASIK surgery is performed by an ophthalmologist who uses a laser or microcatheter to reshape the
Effects of it. Dry eyes. Some people experience dry eyes for the following surgery. Although it is temporary, it can be developed into dry eye syndrome. It is very
start. Good morning. My name is Prajesh.
My name is Rahim. My name is Karan.
I am going to explain you what glaucoma is. Glaucoma is a group of eye diseases which result in the damage to the optic nerve and retina. There are three signs of symptoms: visual field loss, optic weakness, increased coverage ratio of endoscopy examination. And there are three causes: dietary, ethnicity, and genetics.
If treated early, it is possible to slow or stop the progression of disease with medication, laser treatment or surgery.
Good morning. My name is Shama.
My name is Suraj. Today we are going to explain on the topic stereo vision or 3D vision. So, a 3D means three-dimensional image. And three dimensions are height, width, and depth.
And when we view a 3D, it is actually captured with two cameras which are 3D just right. What is filter inside and what is filter inside. The side effect of this is both combined together give you a more helpless. When you view these two glasses, are great as the interpretation and interpretation.
Start.
Good morning everybody. My name is Vanish. Our topic is about lens. Lens are located in eye. By changing its shape and changing the lens changes in the focal distance of the eye. In other words, it focuses on the light rays of the various distance. In other words, it is also work together to cornea to react the power of the eye. I am going to show you the disease affected to the lens. Cataract. The cataract is a disease that is affected to the lens. Cataract is a clouding of lens in the eye which leads to decrease in the vision. It is affected to one or both the eyes. Thank you.
Good morning. My name is Levin and this is Kaushik. We are going to talk about the working and function of the eye.
On the basis of how the image is formed through the eye. First, starting off with the cornea is also called as the human camera. It captures the picture depending on how much light rays is fallen on it. It bends the light rays so that it can pass freely through. Next comes the iris.
The iris acts like a shutter of a camera. It has the ability to enlarge and shrink depending on how much light rays are passing through the eye.
Next is the retina. The retina is the most.
Thank you.
Good morning. My name is Atmiya and he is Tarun and we are going to explain the structure of the eye. Now, I'll say my friend Tarun to explain the basic stats of the eye.
The eye is one of the major sensory organs in the human body. It is responsible for vision, color differentiation. The human eye can differentiate between 10 major colors and biological clock of the human eye.
Now, I'm going to say about some of the basic structures of the eye, like the ciliary muscles. These control the thickness of the lens so that we can focus into any distant images. The cornea. Cornea is one of the layers which helps in the passage of light into the lens so that we can easily see the picture. The sclera. It is a tough white outish layer which protects the inner layer of the eye. Thank you.
Good morning. My name is Lisa and she's my friend Vaishnavi. Our topic is squint eyes. A squint eye is also known as paralysis. It is a condition in which eyes do not align properly. One of them turns inwards, upwards, downwards or outwards. There are 4 types of squint eye. We have to eat more carrots and spinach and avoid more junk food. Carrots and spinach has more of healthy eye vision maintenance so that we can
Good morning. My name is Sabrina.
My name is
cell is.
We are going to talk about rods and cones cells.
The retina is responsible for passing any light information that arrives at it through the optic nerve to the brain. The retina consists of both rod cells and cone cells.
I am going to say rod cells.
The simple definition is a simple demonstration of this is go to the outside or look directly at them. We may not see much, but if you try to study the rod cells are functions.
My friend is going to say cone cells. Thank you.
Good morning, my name is Lavanya and my friend name is Savita. We are here to speak about donation of eye and my friend Savita is going to explain about donation in detail.
Eye donation is an act of donating one's eye after his or her death. Only corneal blinds can be benefited through this process, not any other blinds. Now my friend is going to explain what is corneal blindness.
Good morning everybody. My name is Kirtan.
And my name is Shiva.
We are going to talk about eyes of animals. Firstly, we are going to talk about three animals: snakes, dogs, and cats. Snakes. My friend Shiva will explaining about snakes.
Snakes have two sets of eyelids. One eyelid is used to see objects like we are seeing. The other eyelid is used to see the heat vision.
Good morning, my name is Neha and my name is Karika. My friend is going to explain part. As we can see, this is a brain and this is a brain have many different parts like frontal lobe, temporal lobe, and this is an eye and it has an optic nerve. Optic nerve is a nerve which connects brain and eye. Not only brain and eye, it connects eye to ears to brain, leg to brain, etc. Thank you. Good morning, I am Umair and today we will be talking about Lufthansa. As you know, Lufthansa is a German airline and it has been improving from the past to the present. So today we are going to be talking about the fleet of Lufthansa. Lufthansa has a vast number of planes in its fleet. It has 15 planes with the main one being Boeing 747.
Hi, I'm Jeminos and I'm going to talk about the engines of Lufthansa. First of all, Lufthansa is not making the engines of their own.
I'll talk about the advantages of Lufthansa. They provide us delicious food, free Wi-Fi, and
Thank you. And today we'll be talking about Lufthansa. Lufthansa is a German airline and it has been improving from the past to the present. I'll be talking about the past. In the year 1961, they earned about 281 million euros. Now they earn more than 1.5 billion euros. In the year 1954, they bought their first aircraft, that is a Convair 357. Now, thank you.
So today I'm Rafun and today I'm going to be talking about the fleet of Lufthansa. Lufthansa has a vast number of planes in its fleet, mainly being the Boeing 747 and the Airbus A380. Lufthansa has also ordered the A350 XWB and it currently has one, but it has already ordered.
Hi, my name is Jeminos and I'm going to talk about the engines of Lufthansa. Lufthansa is not making the engines of their own. They're buying it from Rolls-Royce. Rolls-Royce was also started in Germany, so that they were having good relationship between
Good
them.
morning, my name is Riaz. I will talk about the advantages of Lufthansa. Lufthansa provides us delicious food, free Wi-Fi, and they give food each for us. When you are traveling to abroad, they give you Lufthansa pen, Lufthansa pencil, Lufthansa notebook.
Hello, I'm Sakuri and I'm going to speak about Boeing. The inventor of Boeing was William E. Boeing and the designer of Boeing 747 was George Shutter. Boeing has 4 engines while Boeing 737 has 2 engines. Boeing 747 amazingly carries 660 passengers.
Hi, I'm Afshan and I'm going to speak about the basic details of Boeing 737. It is an American company which sells, manufactures and designs airplanes, rotorcrafts, satellites, etc. It also have the widest seat.
Boeing is a very big manufacturing company. Now Boeing has launched a new aeroplane named as Zero G, which helps the astronauts to know more about the space in the atmosphere.
Boeing 767 drone wide-body jet airliner, a national origin United States, manufactured Boeing.
Good morning, my name is Mohit. We are going to talk about Tejas jet. This is a vertical stabilizer. This is the horizontal stabilizer. Now my friend Ayush is going to tell about the speed.
The speed of the aeroplane is 2205 km per hour. There is only one engine and the one seat. And the first flight was on 4 January 4, 2001. Thank you.
Thank you.